Okay, so we will take radiology only important images. Rest of the images I will cover with the systemic sessions. Okay, so we will start now. We will take a look at the only classical images today. Okay, try to answer. Okay, so first one, what is this? You can take a look and try to answer. What do you think? Anyone? No one? What is this? Got the confusion? What is this? And what is this? Right? That's why you get questions again and again. I will draw a diagram. After that, whenever you are getting question marked on a chest X-ray, please take a look while solving. First notch, or you can say first curve, second curve, third curve, and then comes a last large fourth curve. Okay, this is going to form the left border of heart. Like this, and something comes from the down as well. Okay, first notch on chest X-ray is aortic notch. Is aortic notch. Okay, second curve is pulmonary trunk. Third curve is left atria, and last large curve is left ventricle. What is it? It is left ventricle. Our heart is tilted. Okay, the classical image which you see of heart is not exactly seen on the X-ray. Okay, our heart anatomically it is tilted. So what you are seeing on the right side is actually right atrium only. What we are going to see, right atrium, right ventricle, something over here. Okay, RA, something like this. So you will not get the question, sorry, RV. You will not get question to identify a right ventricle. Okay, so now if you have a look, now try to answer. It is aortic notch. Second one is pulmonary trunk. Third one is left atria, and last one is left ventricle. Okay, understand this. That's why you will think you marked the right question, but it was actually wrong. Right? What is this? I just said it. It is right atria. Right atria. One liner comes. Right border of heart is formed by. Is formed by, just remember the mnemonic which I am going to give. It is SIR. That is superior vena cava, inferior vena cava, and right atrium. Okay, These are the parts which are going to form right border of the heart. बाकी कैसे याद रखना है? Rest all will form the left ventricle. याद रखना है हमें बस. Okay, technically वैसा नहीं है, but still you can remember it like this. You will, when you are going to get question, left border of heart is formed by except, okay, and right ventricle, right? They are not going to form the left border of heart. That's it. Okay. So now you got the question second time like this. Which is this rib? Okay. Now take a look. What do you think? Which is this rib? Anyone? Can take a wild guess? No? I will make it clear. Actually, this is not the rib which you are seeing. They have asked you the rib which is in the back. Right? Back से आई आगे. So they are asking actually this rib. Take a look over here. Fourth rib कैसे गई? ऐसे. So if I am going to mark which is this rib, then actually you have to answer which rib? This one. Okay, this one. Now take a look. 1, 2, 3, 4. Right? 1, 2, 3, 4. But if you remember anatomically very well, first rib is going like this. Okay, first rib is going like this. So actually answer was fifth rib. How you will remember? The rib which you are seeing. Okay, अभी confusion हो गया ना? जो पहले दिख रहा है सबसे बड़ा rib is actually second rib. Is actually second rib. So यहाँ पे देखो कहाँ से गिनोगे तुम? First, second, third, fourth. 4 plus 1. So actually it was fifth rib. Right? Confusion दूर हो गया. This question has been asked in your exam hall. Right? What is this? This angle is called as CP angle. Okay, costophrenic angle. CP angle. At least इतना आना चाहिए. Okay, take a look. Just I said you this thing. First curve, second curve, third curve, and biggest large curve is left ventricle. Okay. Now comes the question on the, what is this first? Anyone? The ring which we will put in the valves. These are valve rings, right? छल्ले दले सुना है? छल्ले दले है ना? छल्ले यही होते हैं. Okay. Now, if you have taken a look on normal anatomical valves, right? They are same. They are same. Just you have to take a look properly. Right? Pulmonary valve. In between atria and ventricle, what we have? ट्राइकस्पिड वॉल, राइट? ऐसे बनाएंगे तो kind of like this. So we have tricuspid wall, so it will be tricuspid wall, right? Aorta opens in right atrium, so it is aortic wall, right? So remember it like this: PAMT, PAMT. Okay, the most superior wall is pulmonary wall. A for aortic wall, M for mitral wall. एक्सरे बस सीधा आएगा ऐसा होने वाला नहीं है. Okay, lateral X-ray can come as well, and actually this one came. Right? सबसे ऊपर pulmonary है, second in the line is aortic, third in the line is mitral, fourth in the line is tricuspid. You have to remember this. Take a look again and again. चारों के चारों rings देंगे नहीं, only single ring is going to come. Anatomically think करना है, it is just the same. Okay, it is just the same. Change होने वाला नहीं है इसके अंदर. Now tell me, what is this first? What is this? What do you think? It is a pacemaker. क्या है? Pacemaker है, हार्ट में डालते हैं, राइट? Yes, it is a pacemaker. Then comes, which is this pacemaker? Single chamber or dual chamber? Take a look properly. One wire, second wire. Over here as well, one wire, second wire. So of course it is a dual chamber pacemaker. क्या होंगे? This is a dual chamber pacemaker, right? Dual chamber है. कहाँ कहाँ दिख रहा है? Again think anatomically. यहाँ पर क्या था? It was right atria. Right atria के नीचे क्या होगा? Of course it is going to be right ventricle. So dual chamber heart pacemaker, we will put it in right atria plus right ventricle. Okay, single chamber कहाँ डालेंगे? Single chamber pacemaker will go in right ventricle. Right ventricle. Ventricles are more important for the survival than the atria. Okay, so we will put the pacemaker in right ventricle. Okay, but your life doesn't finish over here. Dual chamber pacemaker is placed in. Now what do you think? What will be the answer? I just said, what is important? Ventricles. So we will put it in right ventricle. This was your exam question. If they are going to ask single best answer, answer will be right ventricle. Of course, if they will give both options together or A and B, of course, answer will be both. Yes, right, correct. Now, if the ECG comes, how we will define that it is a pacemaker ECG? Take a look over here. These lines before complexes, a straight line before complexes, that means it is a ECG with pacemaker. Okay, ECG with pacemaker. Then comes a, you can say it, forensic medicine question. Before declaring patient dead, okay, before declaring patient dead with pacemaker, what should we do? Remember, we have to remove that pacemaker. Okay. Second thing, our rituals for dead people says burning, right? In Hindu rituals, if you will keep that pacemaker, it can blast because it has a batteries. Okay, it has a battery, so we have to remove that pacemaker, and then only we will declare patient dead after doing a ECG, right? ECG पे क्या मिलेगा? Flat line. We will see flat line. Okay. Next addition है ना? Next बोलते हैं सब. So this is next pattern. A patient with chest heaviness, 30 month, okay, 30 month, बच्चा है, with systolic murmur and increased pulmonary vascular marking with right ventricular hypertrophy. What do you think? This can come question as direct without image. And whenever you are going to get questions, this is what you need to catch. In a children's cardiology, answer is atrial septal defect. Answer is ASD. Systolic murmur with increase in pulmonary vascular marking, that is called as great Heiler dance. You would have heard this term, great Heiler dance on fluoroscopy. This is not X-ray. On fluoroscopy, it is not X-ray. Okay, it is just the image. What you will see, you will see a video. Great Heiler dance. What is going to happen? The markings on the X-ray is going to increase. These are pulmonary vascular markings. Vessels बड़े हो जाएंगे, ऐसा समझ लो. ठीक है? So it is seen in AST. What is AST? Defect between atria, right? Defect between atrial septa. So there will be a hole which is going to present between both atrium, right? Between both atrium. Most common type of ASD. Can anybody tell? It is ostium primum or ostium secundum. What do you think? It is every time, remember, yes, it is secundum. Okay, primary comes first, so that's why you will think that it is primum. No, it is secundum always. What is the answer? It looks like a goose, right? same it is called as goose neck deformity. Goose neck deformity seen in yes, it is seen in endocardial cushion defect. It is seen in endocardial cushion defect. It is also a subtype of ASD. क्या है? This is a subtype of atrial septal defect. So you can get in the option endocardial or gooseneck deformity is seen in, that is going to present in GI tract. Okay, GI tract में मिलेंगी, हार्ट में नहीं. Okay, gooseneck in GIT is seen in ileocecal TB. Gooseneck on heart is seen in endocardial cushion defect. Endocardial cushion defect is not in the option. Then what you will choose? You will choose ASD. You will choose ASD. Okay, you will choose ASD. Yes, it is tetralogy of palate. You would have seen the answer if someone is very clever. Answer is Core and Sabot. That is tetralogy of palate, right? इसी को हम बोलते हैं core and sabot, or also called as boot shaped heart. Boot shaped heart. Okay, boot shaped heart. Right now, tell me what is the content that you see in boot shaped heart or tetralogy of palate? P से क्या आता है? Pulmonary stenosis. R से आता है राइट वेंट्रिकुलर हाइपरट्रॉफी. O से आता है ओवर राइडिंग ऑफ एओर्टा. एंड V से आता है ventricular septal defect. So your heart will look like this. Okay, ventricular septal defect. Ventricles के septal में defect होगा. Overriding of arch of overriding of both the aortas, right? Then comes right ventricular hypertrophy. Okay, right ventricular hypertrophy. This you will see in tetralogy of palate. Okay. It look like something is tied. Egg is tied with the wire or string. Egg on string appearance is seen in yes, that is transposition of great arteries. Transposition of great arteries मतलब क्या हुआ? कौन से great arteries हमारे में? Which great arteries are there? There are two: arch of aorta and pulmonary trunk. What is going to happen? Interchange. They will switch the normal position. Now, arch of aorta, if you can appreciate, Take a look. Arch of aorta is going to open in left ventricle. What is going to happen? Arch of aorta is going to open in right ventricle now. So does pulmonary trunk normally opens in right ventricle. What is going to happen? Pulmonary trunk is going to open in or start from left ventricle. That is called as transpositioning. Okay, that is called as transpositioning. Okay. Yes. What is this? This is called as box shaped heart. Seen in? Yes, you know it. I know this. Easy में है ना, तो आते हैं, मुझे पता है. It is seen in Epstein anomaly. It is seen in Epstein anomaly, right? Cause of which drug causes Epstein anomaly? Anyone? Yes. माँ पागल थी. How you will remember? माँ पागल थी. Mother intake of lithium. Okay. Mother intake of lithium, right? Yes. Pregnant lady, that is mummy, was psychiatrically ill, right? Or patient is on some kind of homeopathic medications. Homeopathic medications do have lithium for the treatment. It is called as snowman appearance, right? Snowman appearance, or it is also called as figure of 8 appearance. Figure of 8 appearance is seen in, yes, total anomalous pulmonary venous congestion. Total anomalous pulmonary venous congestion. Okay, it is seen in this. ठीक है? What do you think? Take a look over here. Something is coming from the down. Something is coming from the down in the chest. Abdomen से कुछ तो आ रहा है. It is called as shimitar. Okay, shimitar sign. Shimitar sign, or this is a Turkish word. You can remember it like talwar sign. Okay, shimitar sign or talwar sign is called a, is seen in, anyone? It is seen in partial anomalous pulmonary venous congestion. टोटल में क्या मिल रहा है? स्नोमैन. पार्शियल में क्या मिल रहा है? शिमिटार, और यू कैन रिमेम्बर इट लाइक तलवार साइन. ओके, चल, अंडरस्टूड. टेक अ लुक ओवर हियर एज वेल. ओके, partial anomalous pulmonary venous congestion. What is this? Anyone? It is called as figure of 3. Figure of 3 on chest X-ray. Remember it like this. Figure of 3 on chest X-ray is seen in, yes, correct, it is coarctation of aorta. It is seen in coarctation of aorta. Okay, but if we will do barium study, what we are going to see? It is called as reverse 3 sign. Reverse 3 sign. Okay, क्या बोलेंगे हम इसे? Reverse 3 sign. What happens? Coarctation of aorta. Just remember it like this. जो हमारी aortic arch आ रही है, aortic notch, it is going to be compressed. Okay, it is going to be compressed. So that's why we will not be able to see fully dilated aortic notch. क्या होगा उसके बीच में? एक जगह पे पिंच होगा, दब गई. उसके वजह से we are going to see figure of 3 appearance. Okay, actually यहाँ पे क्या हुआ है? Compression. Okay, compression हो गया. That's why we are going to see figure of 3 appearance. ठीक है, चले. What you will see? Something is there except figure of 3 appearance. क्या होता है? What is this? What do you think? Normally ribs are going to stay straight, but what is going to happen over here? Okay, like this. So take a look over here. It is called as rib notching. It is called as rib notching. Okay, yes. What is this? You all came from the foreign. You would have seen a foreigner guy who is eating egg in a cup, right? Breakfast में खाते हैं, right? Like this. They will tear it from here. Same we are going to see in X-ray. And our egg is heart. Egg in cup appearance is seen in which disease? कैल्सिफिकेशन हुआ है यहाँ पर. Is seen in, yes, constrictive pericarditis. Treatment? Anyone who can tell? Let's check your knowledge. बस इमेज पढ़ने से थोड़ी होता है. ट्रीटमेंट? ऐसे दिखेगा हार्ट. We have to remove the calcified part of heart. Okay, myometrium, endometrium जहां पर भी होगा, we have to remove that calcified part. That is the treatment. And believe me, it is not going to happen, right? Nobody is going to take the risk to remove calcified part because patient can die on beds. Treatment is a surgical removal. Second is heart transplant. Both are rarely done. What you have seen? You have seen a white line over here, right? You have seen a white line. Now comes a black line. नाउ कम्स अ बैकलाइन, इसी को हम क्या बोलते हैं? न्यूमोकार्डियम। न्यूमोकार्डियम, राइट, इसी को हम बोलेंगे न्यूमोकार्डियम। entrapment of air in the heart borders or in the myometrium, okay, हवा चली गई है अंदर उसके, that is called as pneumocardium. What will be the treatment? Put a needle and remove the air, that is the treatment for this patient. Yes, puncture, okay, we will put a needle and remove that, okay. तुमने कभी पायोकार्डियम सुना है? पायोकार्डियम, does it happen? Yes, it happens in TB patient as well, okay. इंडिया में टीबी पेशेंट्स में मिलता है. You will see pus in myometrium of heart. Again, same treatment. We will put a needle and remove it, like we do for the pleural tapping. Same we will do it over here. We will remove it. If there is a TB, we will give anti-TB drugs. है ना? और कोई दूसरा सस्पेक्ट है? Of course, the pus which we are going to take, we will send it for. It happens in India in TB patients. Okay, we will give ATT. We will take out that pus. We will send that pus for what? Culture and sensitivity. We will check, and CBNAT for TB, फंगल कल्चर एज वेल. हम चेक करेंगे उसमें कि ये किसके लिए सेंसिटिव है, एंड देन वी विल ट्रीट अकॉर्डिंगली. बट इंडिया में ब्लाइंडली वी हैव टू स्टार्ट ATT बिकॉज मोस्ट ऑफ द टाइम इट इज गोइंग टू बी TB. Okay, it is going to be TB. What is this? Yes, you can call it tennis ball sign and something like this. I'm not good with the drawing. You would have seen a ball or image which has black and white, है ना? इसी को बोलते हैं yin and yang sign. टेनिस बॉल साइन, करेक्ट. एक व्हाइट है, एक ब्लैक है. इट इज गोइंग टू बी सीन इन एओर्टिक डायसेक्शन. क्या हुआ है यहाँ पर? डायसेक्शन इन एओर्टा. जो हमारी एओर्टा है उसमें कट आ गया. वी हैव डायसेक्टेड द पाइप, ओके, दैट इज कॉल्ड एज एओर्टिक डायसेक्शन. Now tell me which one is normal and which one is present in you, young generation. All of you are smoker, right? All of you are smoker. So normal is not normal nowadays. This one is normal. This one is for COPD patient, right? Sooner or later, your X-ray will become like this. Now, tell me what is the difference between COPD X-ray and normal X-ray? Take a look first. सबसे easy है. What has happened over here? It is called as flat diaphragm, right? Flat diaphragm. और क्या हुआ है? If you can take a look over here, the intercostal space is almost same. Intercostal space is almost same. CP angle is not reduced. Actually, it is increased. एक ऐसा एंगल है और एक ऐसा एंगल है, फर्क है ना? It is increased. Okay, not reduced. Okay, it is increased. 90 degree की तरह दिख रहा है. And this one look like 45 degree, right? So it is increased. What has happened? Okay, come back again. The intercostal space is almost same. Now take a look over here. What is happening? The intercostal space is increasing. That is called as, what we will call it, widening of intercostal space. Okay, this is the classical features that you will see on X-ray of COPD patient. You know? And take a look. This X-ray lungs look small. Pura rib cage, it looking like a small. But if you will take a look at the COPD X-ray, it will look broader. Okay, broader. बड़ा सा दिख रहा है ना? So there you will see a broad X-ray. ये X-ray आता है, पेपर में भी आ सकता है. And this is the X-ray where you will going to see in your practical day-to-day life. ठीक है, सब कुछ बस पेपर के लिए है नहीं. What do you think? What is this? क्या प्रॉब्लम है इस एक्सरे में? There is nothing. It is an X-ray of female, right? So there is absent breast on what? On the right side of X-ray. On the right side of X-ray. So it is either patient is of mastectomy. Patient is of mastectomy, removal of breast, right? Post breast cancer surgery, right? Or patient has absent breast from the childhood age. Which syndrome you will see absent breast? Anyone? Congenital absence of breast is seen in which syndrome? The name of syndrome is Poland syndrome. And this image has been asked for this one. This is in the line for the next. Okay. What happens in Poland syndrome? What is actually absent? Which muscle? No one. It is pectoralis muscles which is going to be absent in Poland syndrome. That's why you will not see the shadow of breast. That's why you're not seeing the shadow of breast. Okay, if I will give you the city of Poland syndrome, take a look over here. This is pectoralis muscle. This is pectoralis muscles, and it is absent over here. Same city will go for breast mastectomy. Okay, what is absent over here? Absent pectoralis. Okay. Pollen syndrome is associated with what? Your one-liner questions. Mobius syndrome and Klippel-Feil syndrome. Klippel-Feil syndrome has been asked already. Okay, पूछा जा चुका है. So anything can come. Try to answer the exact same question has been asked. Patient presented with breathlessness, difficulty in breathing, or you can call it as shortness of breath. BP is 200 by 140. Patient is having edema. Patient had history of MI. Bilateral wheezes or creps are present on auscultation. और एक हिंट ऐड कर दी तुम्हारे लिए. What is the diagnosis? सिंपल क्वेश्चन, फार्मा क्वेश्चन है, मेडिसिन क्वेश्चन है, पैथो क्वेश्चन है, रेडियो क्वेश्चन है. And this is the question which you will see daily in emergency department. MI की हिस्ट्री थी, right? MI peoples are tends to have something called as congestive heart failure. Patient को क्या हुआ है? There is heart failure, right? Bilateral wheezes with pulmonary edema. With pulmonary edema, दो ही निकलते हैं. Either patient is having congestive heart failure or patient was of CKD, chronic kidney disease. Okay, CKD के patient में भी you can have pedal edema if they are on the dialysis but they are not taking dialysis. So उसके अंदर भी wheezes या फिर creps मिलेंगे. Reason? Fluid overload. Fluid overload फीचर्स क्या है उसके? Bilateral wheezes and creps कहाँ मिलते हैं? लंग्स पे. रीजन? फ्लूइड रिटेंशन इन लंग्स. उसी को हम बोलते हैं पल्मोनरी एडेमा. पल्मोनरी एडेमा का मतलब ये मत समझो कि द एडेमा व्हिच यू सी ऑन द स्किन. नो, दैट मींस फ्लूइड रिटेंशन. फ्लूइड रिटेंशन ऑन द लंग्स, दैट इज कॉल्ड एज पल्मोनरी एडेमा. ओके. पेशेंट का बीपी हाई है, वीजस प्रेजेंट है, पीडल एडेमा था, मायोकार्डियल एमआई की हिस्ट्री दे रहा है, तो 99% the patient is of congestive heart failure, right? Even CKD patient present with CHF only when they are about to die. Okay, patient need urgent dialysis that time. Even in that, this patient create can be increased, the case which is present in front of you. सब complex है यार, but just remember BP increase है, pedal edema है, MI की history है, CHF. Even CKD patient, pedal edema, bilateral wheezes, patient is now in CHF. Okay, he need dialysis to decrease this CHF effect. ठीक है. So what you will give to this patient? BP increase है, MI की history है, and patient is with fluid overload in the lungs. हाँ, they will write down urine output present. Yes, it is what you study and what you actually have to mark is different. Labetalol we will not give it. We will give Lasix, that is called as furosemide loop diuretics. Reason being, we have to decrease the fluid overload. So we have to make sure that patient is going to urinate again and again. As soon as you will give Lasix, patient का fluid overload कम हो जाएगा, right? And patients के ये जो wheezes and creps है, that is going to decrease slowly. Okay, and जो difficulty in breathing भी होंगी, that is also going to be decreased. Okay, so we will give diuretics, not labetalol. Make it clear. बीटा ब्लॉकर पढ़ते हो ना तुम, एमआई के पेशेंट में बीटा ब्लॉकर्स देनी चाहिए, बट ओवर हियर वी आर नॉट गोइंग टू गिव. रीजन इज वी हैव टू डिक्रीज द फ्लूइड ओवरलोड. ओके, एमआई से बचाने से पहले उसको सीएचएफ से बचाना है. ओके, सीएचएफ से बचेगा, वाइटल स्टेबल होगा, तब जाके यू कैन डू एंजियोप्लास्टी. टिल देन you cannot. Okay, the classical x-ray which you see is called as batwing edema, but believe me ये नहीं मिलता. Okay, batwing edema, batwing appearance, sorry. Okay, as soon as you see such x-rays, इसे pneumonia मत समझना. It is not pneumonia. Okay, you have to look at the case history, what is given by the examiner, वरना पक्का गलत है आंसर. Okay, 110%. Everything white on the x-ray is not pneumonia until unless infection की history है, cough है, fever है, uremia है, then only we will say it that it is, what is it? It is pneumonia, right? If you will do ultrasound, okay, ultrasound, x-ray भी इतने clear आते नहीं है. If you will do ultrasound of chest, you will see curly lines. ICU में करते हैं. Okay, we will do it in ICU to see curly lines on chest के फ्लूइड ओवरलोड अभी भी कम हुआ है या नहीं है. इफ कर्ली लाइंस आर प्रेजेंट, दैट मींस पेशेंट इज इन फ्लूइड ओवरलोड. ओके, पेशेंट इज इन फ्लूइड ओवरलोड. पढ़ाया होगा तुम्हें. इट लुक लाइक दिस, इट लुक लाइक दिस. ठीक है, इट लुक लाइक दिस. चलो, व्हाट इज द आंसर? नाउ RR is more than 30 per seconds. What is normal RR? चलो, रेस्पिरेटरी रेट नॉर्मली कितना होता है इन अ नॉर्मल पेशेंट? अराउंड, चलो अराउंड 20. ठीक है, 15 to 18 वट एवर. ठीक है, 20 से नीचे, 20 से नीचे. व्हाट इज रिटन इन दिस क्वेश्चन? RR more than 30 per second. 30 per second. If patient is going to have RR at 30 per second, the patient's lung will come in doctor's hand. 30 से छाती ऊपर नीचे हो रही है per second. Okay, that means even not in doctor's hand, it will touch the roof of the hospital, that to top floor. Okay, so remember, respiratory rate more than 30, right? Correct, but per minute. Okay, it is per minute. That is called trolling, and it happens every times in your exam hall. Okay, कर सकते हो किस लिए यूज करते हैं? We will use it for pneumonia, right? Pneumonia. ठीक है, चलो, we will discuss this again in our respiratory class. Then comes a difficult question: which lobe is involved in this pneumonia? Okay, pneumonia के features देंगे and they will ask which is this lobe involved in pneumonia. What do you think? There is no trick. You have to remember it carefully. Okay. This is PA view. PA view means from back side to the front side. The X-ray which we are seeing actually is taken from the back side. So what you need to remember, the lobe which we see from the back side. Anatomy में बताते हैं, right? Lobes, right upper lobe, middle lobe, है ना? Inferior lobe. So that lobes you have to remember. There is no trick to remember. Now just I will try to revise. COPD patient, most common organism causing pneumonia. Anyone? In COPD कौन करवाता है? In burn patient, most common organism causing pneumonia. Most common organism causing community acquired pneumonia. Most common organism causing hospital acquired pneumonia. Most common organism causing ventilator acquired pneumonia. Most common organism causing pneumonia in a Bevda alcoholic. See, it is very easy, but as soon as I'm throwing the questions, answer are getting mixed, right? Answer are getting mixed. So please study the table which is given in your notes as well. I am also going to give it. Case बना के देंगे अच्छे से, and you have to decide whether it is community acquired pneumonia, hospital acquired pneumonia और ventilator acquired pneumonia था या patient was alcoholic. ठीक है, even they can give you the history of alcoholic patient but pneumonia happened in the hospital, so answer will be hospital acquired pneumonia. Change होंगे answers. Okay, so याद रखना ये टेबल. Okay, ये आ चुका है पेपर में. Easiest one should not be marked wrong. क्या बोला मैंने अभी? They can give the case alcoholic patient. Okay, pneumonia symptoms was not present. He came to the hospital. Now he's on bed, normal bed. So what is the cause for pneumonia? Answer will be staph aureus, right? But patient is on the ventilator. Answer will change to pseudomonas or staph pneumoniae. Okay. Only alcoholic. Answer will be Klebsiella, right? Red currant jelly sputum. Classical feature है alcoholic with red color jelly sputum. Answer will be Klebsiella only, right? So ये change होता है. You have to remember this, and we will have to treat the patient according to the organism and culture sensitivity test. So you should know this one. Okay, आना चाहिए. Easy है, hard नहीं है. बस टेबल एक बार रट लो. Okay, examiner's favorite image. It is called as cannon ball metastasis. क्या बोलेंगे हम उसे? Cannon ball metastasis. Seen in? Yes. Just remember, whatever present in the abdomen can cause metastasis in liver and in the lungs. Okay, can cause metastasis in the liver and the lung. So cannonball metastasis happens in which? Yes, most of you are marked correct. Renal cell carcinoma, ovarian carcinoma, मेल में क्या होता है? प्रोस्टेट, राइट, एंड ब्रेस्ट कैंसर. रिमेंबर, sarcoidosis is every time diagnosis of exclusion. कोई भी केस आए, sarcoidosis मार्क करने से पहले याद रखना, इफ रेस्ट ऑफ द थ्री ऑप्शंस यू आर नॉट एबल टू अंडरस्टैंड कि ये आंसर होंगे या नहीं, then only go for sarcoidosis. Okay, sarcoidosis is always going to stay as diagnosis of exclusion. Okay, diagnosis of exclusion. मार्क करने से पहले दो बार सोचना है कि ये sarcoidosis है या नहीं है. Okay. Examiner's favorite images are there. What has happened? In normal X-ray, we see CP angle. Are we able to see CP angle? No. It is called as obliteration of costophrenic angle, right? Costophrenic angle. And classical image, which comes is Ellis curve. Ellis curve. Ellis curve, right? It is seen in pleural effusion, correct? Pleural effusion, right? हर बार यही इमेज आए ऐसा तो नहीं है, right? Classical image are not classical when it comes to clinical practice. देखो यहाँ छोटी सी दिख रही कर्व, and obliteration of CP angle. Over here you can see CP angle, right? But it is not there. ऐसी भी में जा सकती है. Even they can give you sleeping position X-ray समझने के लिए. Take a look over here. क्या हुआ? This pleural effusion went like this. You know, pleural effusion. It is in pleural cavity, so it can move wherever there is a pleural cavity. Lungs के अंदर नहीं है ये पानी. This is present in pleural cavity, gap between lungs and ribs. Remember like this. तो पानी कहाँ हो गया? As soon as patient sleeps, it moves. It moves, right? Now, tell me, if we will do auscultation, if we will do auscultation of this patient, what you will hear? This side में क्या होगा? नेक्स्ट पैटर्न तुम्हारा जो सब लोग बोलते हैं, डराया है वो है ना तुम्हें सबने. नेक्स्ट पैटर्न इज नथिंग, इट इज मोर ऑफ अ क्लिनिकल अप्रोच. ओके, एज अ डॉक्टर you will hear decrease air entry. That's it. दिमाग नहीं लगाना है. Decrease air entry. Air entry will be decrease. Reason, वहां पे पानी है तो हवा जाने के चांस है ज्यादा नहीं है. लंग्स इधर कोलैप्स हो गए. रीजन, प्लूरल कैविटी में पानी भर गया. So you will be not able to hear the bronchovascular sound. So decrease air entry, right? Decrease air entry on what? Right side. What is the treatment? What is the treatment? Treatment is put intercostal drainage. Okay, intercostal drainage, that is the definitive management. Pleural tapping हम करते हैं. Okay, we misuse it. Actually we have to put ICD, intercostal drainage. Okay, then comes which criteria is used to diagnose the pleural effusion. Your question, exam question, which is a recent one. Which criteria is used? Yes, it is Light's criteria. Okay, it's light criteria. What are the types of light criteria? Transudative and exudative. Transudative and exudative. Light's criteria is used in pleural effusion. Now how we will remember? लेमैन टर्म में समझेंगे इसको, है ना, हमारी जो भाषा है उसमें समझते. एक्सुडेटिव मीन्स थिक. ठीक, एक्सुडेटिव मीन्स थिक. ट्रांसुडेटिव मीन्स पतला. ओके, ट्रांसुडेटिव मीन्स thin and exudative means thick. If I want to increase the fluid thickness, I have to add something. पानी में कुछ डालूंगा तभी वो पानी गाढ़ा होगा, right? So in exudative pleural effusion, what we will see? More protein and more LDH. That's it. Okay. ट्रांसुडेटिव में मुझे पानी में कुछ डालना नहीं पड़ेगा, राइट? ट्रांसफर थिन पानी होना चाहिए. सो प्रोटीन एंड एलडीएच विल बी डिक्रीज्ड. दैट्स इट. ऐसे याद रखो. एक्सुडेटिव है गाढ़ा पानी, सो सब कुछ बड़ा होगा. ट्रांसुडेटिव पतला पानी, सो सब कुछ कम होगा, राइट? एंड मोस्ट कॉमन कॉज ऑफ प्लूरल इफ्यूजन इन इंडिया इज टीबी. So which type of exudate is common in India? That is exudative. So question किस पे आएंगे? Most of the time it is going to be on exudative pleural effusion. Last time का question था autoimmune disease. Rheumatoid arthritis causes which kind of pleural effusion? The answer was exudative, seen in rheumatoid arthritis. TB यहाँ पर है, TB यहाँ पर है. Okay, and when you don't know the answer, answer is exudative every time. Okay, exudative ऐसे याद रखना है. Most of the things are present in exudative criteria only. Okay, so ये याद रख लो बस. थोड़ा सा याद रखना है, डिटेल में भी जरूरत नहीं है. But remember, when you don't know the answer, answer is exudative pleural effusion. That's it. Pleural effusion means water inside the lung. But what has happened now? There is something which is increasing water as well as air also. Where we can see the air, we can see in trauma, or even in the infection also we can see air plus pus, right? Pani plus hawa. So if you will make a X-ray of this patient, you will see a flat line, no Ellis curve. You will see flat line. The reason, air plus pani, air plus water. That is called as hydropneumothorax. If you will do the CT of this patient, air plus water, right? Hydro means pani, pneumo means air. Okay, hydropneumothorax treatment. Again, intercostal drainage, ICD. Okay, even in this patient we have to put ICD. What is this? Whichever images we are discussing right now, these are the examiner's favorite images. So I will take a time. Okay, सब कुछ easy नहीं है. If you're thinking अरे ये तो मैं कर लूंगा, sorry, it is not that easy, but it looks like. I have shown you the normal X-ray. CP angle ऐसा होता है. Over here, CP angle is not even present on the X-ray. So what has happened? CP angle is going down. CP angle is going down. इसी को हम बोलते हैं deep sulcus sign. क्या बोलेंगे हम इसे? Deep sulcus sign. Deep sulcus sign. Take a look over here. In this, you are able to see the bronchovascular markings, है ना? White color के दिख रहे, faded. But take a look over here. दिख रहा है? नो, इट इज कॉल्ड एज एब्सेंट ब्रोंकोवैस्कुलर markings. It is called as absent bronchovascular marking, right? Again, viscera and pleura. Visceral pleural reflection. ये जो लाइन दिख रही है, स्ट्रेट लाइन आ रही है बिटवीन विसरा, दैट इज ऑर्गन्स, है ना, विसरल ऑर्गन होते, विसरा एंड प्लूरल कैविटी. ये लाइन क्या कर रही है? दोनों को डिफाइन कर ली क्लियरली. ओके, डिफाइन कर रही है क्लियरली. एंड इफ यू हैव टेकन लुक केयरफुली ऑन द normal x-ray which I have shown you at the start of the class, heart is at normal position. Heart is at normal position. So does the trachea. Tracheal ring दिख रही है? So does the trachea. Okay, so there is no mediastinal organs shift. No mediastinal organ shift. So this is not tension pneumothorax. This is simple pneumothorax. Okay, this is simple pneumothorax, right? समझ आया? हार्ट अपने नॉर्मल पोजीशन पे है, ट्रैकिया अपने नॉर्मल पोजीशन पे है. दैट मींस देयर इज नो मीडियास्टिनल शिफ्ट. अब टेंशन न्यूमोथोरैक्स में क्या मिलेगा? वी विल सी सेम फीचर्स, एब्सेंट ब्रोंकोवास्कुलर मार्किंग, विसरल प्लूरल रिफ्लेक्शन, डीप सल्कस साइन, बट heart should be like this, right? Trachea should be over here. Take a look, trachea इधर शिफ्ट हुआ है, tracheal rings मिल रही है. So does the right border of heart. यहाँ पे हार्ट आ चुका है. So does the right border of heart. So what we will see in tension pneumothorax, features of simple pneumothorax, right? Same simple pneumothorax के features मिलेंगे, right? CP angle is going deep, deep sulcus sign, absent bronchovascular markings, है ना, विसरा और प्लूरा के बीच में क्लियर लाइन आ चुकी है. ट्रैकिया इज शिफ्टेड, इट शुड बी ओवर हियर, बट क्या हुआ? ट्रैकियल रिंग इज शिफ्टेड. सो डज आवर हार्ट, राइट बॉर्डर, है ना, अलोंग द स्पाइन होती है ना, यहाँ पर होनी चाहिए राइट बॉर्डर. इट हैज शिफ्टेड टू द लेफ्ट साइड. सो दिस इज कॉल्ड एज टेंशन न्यूमोथोरैक्स. क्या मिल रहा है इसमें? मीडिया स्टिनल shift. What is the treatment? Trolling, again trolling. What is the treatment? Remember, any kind of thorax, any kind of thorax, treatment is intercostal drainage, ICD. Puncture is emergency management for any kind of thorax. Puncture is emergency management. Definitive management is always going to stay ICD insertion. Okay, ICD insertion is a definitive management. So whenever they are asking what is the management of this patient, remember ICD. What is the immediate management? Then only you will mark puncture. वरना क्वेश्चन रॉन्ग है, आंसर रॉन्ग है. तुम्हें लगेगा तुमने सही मार्क किया है, आके रिकॉल में भी लोग बता देंगे आंसर इसका ये है, बट दैट इज नॉट द वे टू ट्रीट दिस any kind of thorax. Answer is always going to stay ICD. ठीक है, मैनेजमेंट क्या है? ICD. Immediate management, then we will go for the puncture. Okay, अगेन एनी काइंड ऑफ थोरैक्स, न्यूमो, हाइड्रो, ठीक है, हाइड्रोन्यूमोथोरैक्स, प्लूरल इफ्यूजन. आंसर इज intercostal drainage. We will put a tube from the mid axillary line, यहाँ पे डालेंगे हम, ठीक है. उसी वही उसकी मैनेजमेंट है. इमीडिएट मैनेजमेंट एज यू सेड, पंक्चर, राइट. थोरैकोसेंटेसिस उसी को बोलते हैं, पुटिंग अ नीडल टू रिमूव द एयर, है ना. सेकंड इंटरकोस्टल स्पेस, फिफ्थ इंटरकोस्टल स्पेस में जो रखते हैं हम, दैट इज अ इमरजेंसी मैनेजमेंट. इट इज नॉट अ डेफिनेटिव मैनेजमेंट. ठीक है, समझ आ गया. हाँ, क्वेश्चन रॉन्ग कैसे होंगे समझ आया एग्जाम में. यही गलती होती है. वी थिंक दैट वी मार्क इट रॉन्ग बट एक्चुअली आंसर वाज रॉन्ग. ओके, हमें लगता है कि हमने सही किया है लेकिन वो सही नहीं था आंसर. वहां पे लैंग्वेज समझनी पड़ेगी. इजी क्वेश्चंस गलत नहीं होने चाहिए. रेयर क्वेश्चन आई अंडरस्टैंड रॉन्ग होंगे, सबके होंगे. यू आर नॉट द ओनली वन विच इज गोइंग टू मार्क रॉन्ग फॉर हार्ड क्वेश्चंस. इजी क्वेश्चंस गलत नहीं होने चाहिए. और ये क्वेश्चन हर कोई जाके वहां पे गलत करके आता है. दैट इज वाई योर रिजल्ट कम्स इन नेगेटिव एंड यू ट्राई टू ब्लेम एनबी फॉर दिस. ओके, समझ आ गया. नहीं करना है. Images do come. Images do come. What is this? A big syringe with a needle going inside the thorax is called as pleural tapping. क्या बोलेंगे हमसे? Pleural tapping. A general knowledge question or PSM question or general medicine question. If you are taking a pleural tapping sample, which investigation should be sent? Which investigation should be sent? पहला क्या भेजेंगे हम इसके? Culture and sensitivity for bacteria, right? Then acid fast bacilli, that is TB, right. We will send AFB for staining as well as culture. मतलब कल्चर भी करेंगे और माइक्रोस्कोप के नीचे रख के एसिड फास्ट बैसिला है या नहीं वो भी देखेंगे, राइट. देन कम्स फंगल कल्चर एंड सेंसिटिविटी. ओके, सब भेजेंगे छोटा हम इसका. जितने भी टाइप के कल्चर एंड सेंसिटिविटी होते हैं उस सब के लिए प्लूरल फ्लूइड विल गो. ओके, प्लूरल फ्लूइड विल गो. ऐसा मत समझना कि इंडिया में टीबी कॉमन है, सो वी विल नॉट सेंड सैंपल फॉर रेस्ट, वी विल सेंड सैंपल फॉर एवरीथिंग. ठीक है, एंड दिस इज कॉल्ड एज इंटरकोस्टल ड्रेनेज, आईसीडी, इंटरकोस्टल ड्रेनेज. ठीक है. नीडल विच वी डू put in tension pneumothorax is called as thoracocentesis. Thoracocentesis. What is this? एनेस्थीसिया. बताओ, मैंने पढ़ा है, वीडियो भी देखा है हमने साथ साथ. इट इज कॉल्ड एज सेंट्रल वेनस कैथेटराइजेशन. सेंट्रल वेनस कैथेटराइजेशन, यस, CVC. ओके, question is finished over here only. This is called as water lily sign. Okay, water lily sign seen in cattle handler. Yes, it is hydrated cyst. Hydrated cyst. Hydrated cyst. Yes. Okay. Actually दिख नहीं रहा. I know that you are seeing यहाँ पे क्या दिख रहा है, कुछ नहीं दिख रहा. But wherever you are going to get a question on hydrated cyst, they will mention cattle handler, okay, or animal handler farmer. Okay. वो लिखेंगे उसके अंदर. दैट इज द हिंट विच यू नीड टू कैच ऑन. नाउ डू नॉट गेट कंफ्यूज बिटवीन water lily sign and lung abscess. Lung abscess formed due to organism. This is lung abscess. Okay, पूरा lung abscess है, and this is pus. Okay, and this is the air which is present in that abscess. Okay, over here looks like a hollow organ, है ना, ऐसा लग रहा है hollow cavity है, but actually यहाँ पर है. So do not get confused between lung abscess and water lily sign. Lung abscess में तुम्हें मार्केशन मिलेंगे, demarcations मिलेंगी, a cavity with a straight line, a cavity with a straight line. Okay, this is lungs abscess. What is this? Pathology question. Brownish body. It is called as ferruginous body. Deposition of what? Yes, deposition of iron. Deposition of iron seen in asbestosis. Seen in asbestosis. Asbestosis. Okay. If we will do the X-ray, on the base of chest X-ray, we will see pleural plaque. Okay, pleural plaque. क्या मिल रहा है इसके अंदर? इसके अंदर गू मिल रहा है. What we are going to get? Goo. Ground glass opacity. Okay, ground glass opacity. Okay, reason? These are pleural plaque. Okay, present on the base of lung. Okay, now you will think that goo is also seen in COVID. Remember, this is a feature on X-ray, not the diagnosis. Okay, diagnosis always will be made with the case. Okay, with the case. So confuse नहीं होना है कि एक्सरे दिया है इसका मतलब ये नहीं है कि वो कोविड ही हो. You have to look at the case which is given in your exam. Okay, ground glass opacity is also seen in COVID, can be seen in other diseases as well. One is asbestosis, that is pneumoconiasis. Yes, correct. Okay, one of the pneumoconiasis do come. What is the treatment? Treatment always is going to stay symptomatic plus change the profession, right? Pneumoconiasis का treatment ही वही है, symptomatically treat करो, nebulize करना पड़ेगा patients को, right? If needed hydrocort we will give it, right? Respiratory distress में जो भी patient आता है उसको we will give nebulization plus hydrocort if needed, है ना? Hydrocortisone, shortest acting IV agent, steroid, right? Same. Even to the patient, what we will tell, if you feel a shortness of breath, take nebulization at the home. Okay, patient को देते हैं. If you are poor and you are not able to give a ring to your girlfriend or boyfriend, you can give this ring for sure, right? On X-ray, it is called as signet ring appearance, right? It look like this, signet ring appearance. Okay, and there is one more appearance. It looks like multiple tram or railway tracks. Okay, railway tracks are lying down on the X-ray. Okay, इसी को बोलते हैं हम ट्रैम ट्रैक अपीयरेंस. क्या बोलेंगे हम इसे? ट्रैम ट्रैक अपीयरेंस. ट्रैम ट्रैक अपीयरेंस. Okay, again remember this. This is a feature on X-ray. इसका मतलब ये नहीं है कि that you will see it only in one disease. Tram track appearance can be seen in so many diseases. So do not make diagnosis until unless something you are able to get from the question. कुछ तो हिंट लगानी क्वेश्चन में कि ये क्या पूछना चाह रहे हैं. ओके, क्लासिकली इसको ही हम बोलते हैं ब्रोंकिएक्टासिस, है ना? ब्रोंकिएक्टासिस. ओके, ब्रोंकिएक्टासिस सिग्नेचरिंग अपीयरेंस क्लासिकली इसमें मिलता है. दैट डजंट मीन्स कि बस इसी में मिलेगा. क्वेश्चन देखना पड़ेगा. रिमेंबर, चेस्ट एक्सरे एंड सीटी स्कैन हर बार सेम नहीं आते. कार्टागेनर्स सिंड्रोम and Young's syndrome. What happens in Cartagena syndrome? What is the classical triad? Yes, immobile cilia, right? What happens in this? Yes. Bronchiectasis. Situs invertus and polyp or sinusitis, है ना? Rhinitis, sinusitis plus nasal polyps. This is the classical triad of Cartagena syndrome. Then comes situs invertus. का मतलब क्या है? Changing the position of all the organs, right? Normally our heart is left sided, it will change to right side. Our liver is present in right side, it will change to left side. Stomach will change to left side, right side, right? सब कुछ change होगा. That is called as situs invertus. Okay, that is called as situs invertus. In Young syndrome, what happens? Bronchiectasis, polyp plus sinusitis. Polyps plus sinusitis. Now tell me, in which disease you will see infertility? Technical infertility. I will make it more clear. साइटस इन्वर्टस भी है और डिसमोबिलिटी इन सीलिया. सीलिया में डिसमोबिलिटी है, सो इसके अंदर एक्चुअली देयर इज गोइंग टू बी infertility, but in Young syndrome it is not going to be technically infertility. Now if you remember, who watches porn more? Which generation? Childhood, young or older? तुम करते हो ना, right? That is young people watches porn more, so they will masturbate more. So what they will have? Azoospermia, है ना? Young watching BP, what will have? Azoospermia, decrease in sperm count, है ना? अब इसका मतलब ये नहीं you are watching BP and you are doing masturbation more, still तुम्हारे पास sperm है, you have sperm, right? So उसका मतलब क्या है? Technically there is no infertility, we will take sperm out of testis and can put in the ovum directly. So young syndrome में infertility नहीं होती. In Carter syndrome there is infertility. Okay, there is infertility. Right? What is the difference between first X-ray and second X-ray? Take a look. Normally, heart is present on the left side. It has changed the position to right side. What has happened in this? What has happened in this? What has happened in this? Normally, stomach bubble is present on the left side of X-ray, but over here, the stomach bubble, जो gas है तुम्हारा, जो पाद है, which change the position to right side. That means it is the image of situs invertus. Over here, only dextrocardia. बस डेक्स्ट्रोकार्डिया है. दूसरे में डेक्स्ट्रोकार्डिया भी है and even the stomach position has changed. So it is situs invertus, changing of position. Situs means side, invertus means changed to opposite side. ठीक है. When you are not able to appreciate anything on the X-ray is called as whiteout lung, and it is seen in COVID, right? क्या बोलते हैं इसे हम? कोविड में मिलता था एक्सरे, राइट? Why? Acute respiratory distress syndrome, ARDS. ARDS can be seen in any kind of patients. Okay, कोविड में हमने देखा है इसे. सो तुम्हें याद भी रखना है, कोविड डायरेक्टली ऑप्शन में आ सकता है. इवन COPD पेशेंट कैन प्रेजेंट विथ acute respiratory distress syndrome. ठीक है. If you can appreciate, what is this? This is endotracheal tube, right? Those who have attended the class, they know this line. It is called as radio opaque line of endotracheal tube, right? Radio opaque line of endotracheal tube. This is called as ground glass opacity. Ground glass opacities. Okay, इसी को हम बोलते हैं गो. Okay, इसी को बोलते हैं ग्राउंड ग्लास ओपेसिटीज. ये कहाँ मिले हमें? वी हैव सीन दिस, है ना? You got to know after COVID came, but actually it was used for other diseases as well. Okay, ground glass opacities. हमने अभी देखा, it is seen in asbestosis as well, right? In COVID, you will see some simple याद रखना. Whenever you are not able to understand a CT scan, who is so whitish? Who is so whitish? इसी को बोलते हैं हम क्रेजी पेवमेंट. क्या बोलेंगे हम इसे? क्रेजी पेवमेंट. क्रेजी पेवमेंट. ओके, क्रेजी पेवमेंट. If you are seeing a totally white, what I am saying, a dot surrounded by like this. Okay, a dot surrounded by less brighter color. Dot surrounded by less brighter color is called as hollow sign. क्या बोलेंगे हम इसे? Hollow sign. Okay, a ring surrounded by less bright, inside you will see less brighter color. It is called as a reverse hollow sign. टेक अ लुक ओवर हियर, है ना, अंदर छोटे छोटे डॉट्स है. इट इज कॉल्ड एज रिवर्स हॉलो साइन. अगेन कहाँ मिलेगा? एनीथिंग कैन बी देयर. अगेन लुक एट द क्वेश्चन. क्लासिकली अभी के लिए रिसेंट कोविड में मिलता है. ओके, कोविड में मिलता है. इसी को बोलते हैं हम गोल्डन एस साइन. इट इज कॉल्ड एज गोल्डन एस साइन. कहाँ मिलेगा? इट इज सीन इन ब्रोंकोजेनिक कार्सिनोमा. ओके, उसके आगे भी लिख सकते हैं विथ राइट अपर लोब कोलैप्स. ओके, golden is sen sign is bronchogenic carcinoma with right upper lobe collapse. ठीक है, right upper lobe collapse. Take a look over here. Diaphragm होता है like this. Something is coming from the abdomen in the thorax. Blackish shadow is coming from the abdomen in the thorax. Is called as congenital diaphragmatic hernia. Congenital diaphragmatic hernia. There are two types of diaphragmatic hernia. कौन से होते हैं? See, if a shadow, what I'm saying, if a shadow is coming from the borders, if it is coming from the borders, it is which hernia? It is Bogdelic hernia. If the shadow is coming from the middle, shadow बीच में से ऊपर जा रही है ब्लैक कलर की, it is Morgagnian. यहां पर क्या हुआ है? Shadow is coming from the border side. अगर यही इमेज यहां से स्टार्ट हो रही होती, द ब्लैकिश शैडो, इट वाज मॉर्गेग्नियन हर्निया. बट अभी कौन सा है? वी हैव बॉगडेलिक हर्निया. ठीक है, मोस्ट कॉमन इज बॉगडेलिक, सो यू विल गेट द इमेज ऑफ बॉगडेलिक. बट स्टिल इसको ऐसे याद रखना है. रिमेंबर इट लाइक दिस. स्पेसिफिकली पूछा गया तो. ओके, योर एग्जाम क्वेश्चन. दिस इज कॉल्ड एज बॉडी पैकर्स. पहले इन्हें क्या बोलेंगे हम वो समझ लो. दिस इज कॉल्ड एज बॉडी पैकर्स, है ना. दे आर स्मगलिंग ड्रग्स, राइट. राइट, माल is not going to be detected easily in the bags. So, माल कैरी कर सकते हो. ये दूसरा वाला माल है. ओके, इलिसिट ड्रग्स जो इलीगल है. ओके, what they will do, they will put a drug in the condoms, tight around and they will swallow it. condoms में swallow करेंगे उसको. they will go to the airport, स्कैन हो जाएगा, बाहर निकलेंगे. when they will reach their destination, they will use enema or some kind of semi solid or liquid, semi solid liquid बाहर आएगा टॉयलेट के रास्ते से. एंड दे विल सेल दैट ड्रग, राइट. दिस इज कॉल्ड एज बॉडी पैकिंग और बॉडी पैकर्स. अब इसमें क्या होगा? व्हाट हैज हैपेंड ओवर हियर? तो वन ऑफ द कॉन्डोम और वन ऑफ द बलून यू कैन से इज फट गया. ओके, फट गया वो. सो व्हाट हैज हैपेंड दैट इलिसिट ड्रग इन जीआई ट्रैक्ट स्टार्टेड एक्टिंग. वो ड्रग उसके बॉडी में चला गया उसके बाद. सो नाउ ही इज शाउटिंग एंड रेस्टलेसनेस हुआ है ना, ड्रग का नशा आ रहा है. So he is telling us the truth. ठीक है, शाउटिंग अब्यूजिंग हो रहा है और एनिमा apparatus उसके पास है, उसका मतलब क्या है, ही इज नॉट लाइंग, व्हाट दे हैव आस्क्ड, wrong statement. Malingering means telling the lie, right, or acting that it is not what is happening with his body. So answer is he is malingering. Actually it is wrong, he is telling the truth. Okay, truth हो रहा है, सच में हो रहा है उसके बॉडी में, शाउटिंग हो रही है, अब्यूजिंग हो रही है, रीजन वन ऑफ द ड्रग इज वेंट इन द बॉडी, सो इट इज ही इज नॉट malingering. ओके, malingering का मतलब होता है एक्टिंग करना या फिर झूठ बोलना डॉक्टर को. Your examiner's favorite question. 1, 2, 3. I think 3 attempts. Everything has been asked till now. Vectral syndrome. What we have in vectral? We have vertebral anomalies, right? Anal atresia, cardiovascular anomalies, tracheoesophageal fistula होता है, esophageal
ନା
atresia है,
ଭଲ ଲାଗୁଛି ମତେ ଭଲ ଲାଗେ ଗୋଟେ
right? Renal anomalies and limb anomalies. So first you got this patient. इसको देख के क्या लग रहा है तुम्हें? What we have in this X-ray? What is this X-ray? Try to answer यार, ये recent question है, मैंने पढ़ाया है तब भी लोग गलत करके आए हैं वहां पे. That is not endotracheal tube, that is Ryle's tube. Okay. Most of the time we take a look at the X-ray, but we forgot the tubings or wiring which is seen on the X-ray. Ryle's tube normally goes like this, है ना? Ryle's tube. But what has happened over here? Coiling of the tube in the esophagus itself, it has not reached the stomach. So उसका मतलब क्या है? Tracheoesophageal fistula. Tube is not reaching the destination. Okay, tracheoesophageal fistula, right? ये image आ चुकी है, right? This image has been asked. Then comes this image, last to last attempt. You are able to see a gastric bubbles. You are able to see gastric bubbles, but it is not reaching the destination. It is not reaching the destination, right? So इसमें क्या हुआ है? Anal atresia, है ना? Anal atresia. Back hole is absent. Black shadow जानी चाहिए ना यहाँ तक. It is not reaching. That means patient is with anal atresia. How it will look? It will look like this. It will look like this. ठीक है? समझ आया? And what are the cardiac association with vectral syndrome? VSD भी मिलेगा, tetralogy of Fallot also seen, ASD can be seen, fetal ductal arteriosus also can be seen. But the most common is VSD, ventricular septal defect. Okay? Mental retardation होंगी इस पेशेंट में? No. We will not have mental retardation. Brain is fully developed. Okay? Mental retardation, vectral syndrome, in short, any kind of anomalies is not associated with brain. Okay? You can take a look over here also. Ryle's tube क्या हो गया? Coil करके बाहर आएंगी मुंह से, but it is not going to reach the stomach. Image आ चुकी है, and it is going to come again. Believe me. आएंगे. कौन सी इमेज बची है? This one. ये बचा है पूछना. Take a look. Vertebra normal है. Vertebra normal है. What has happened over here? This is vertebral defect. Okay, not complete vertebra. ये बचा हुआ है पूछने के लिए भी. Okay, please take a look at this image whenever you are going to get the PDF. आएगा. Okay, what you are seeing over there, there is a constriction in the upper part of esophagus. कैसे याद रखोगे? Constriction in upper part of esophagus. Okay, कहाँ मिलेगा? Upper part of esophagus. है ना? हमें तो ये इमेज आनी है. This is rarely comes, so it is called as esophageal web. कहाँ मिलेंगी? In upper part. Esophageal web. Now comes constriction of esophagus in lower part. यहाँ से stomach start हो रहा है. This is esophagus. Okay, constriction of esophagus in lower part. And it is called as complete constriction. ठीक है, क्या होगा? complete constriction होगा और esophagus छोटा हो जाएगा. It is called as Schatzki's ring. क्या बोलेंगे हम इसे? Schatzki's ring. Yes, correct. This is called as, पहले कौन सी इन्वेस्टिगेशन है? Can anybody tell? There is some radio opaque substance which has been taken by a patient. Okay, radio opaque substance which has been taken by the patient. So it is barium swallow. Okay, क्या है? Barium swallow, and we are seeing thumb sign. What we are seeing? Thumb sign. Thumb sign on barium swallow. Okay, then comes thumb sign on X-ray. Same neck की बात कर रहा हूं मैं. Yes, if you are seeing thumb sign on barium swallow, that means it is Zenker's diverticulum. And if you are seeing thumb sign on X-ray, that means it is correct acute epiglottitis. Okay, Zenker's diverticulum क्या होता है? We will study in ENT. So अभी skip कर रहा हूं मैं. It looks like this. Okay, huh? What has happened? There is a growth which is compressing the esophagus. There is a growth which is compressing the esophagus. It is called as, what do we call it? Esophageal leiomyoma. Esophageal leiomyoma. Esophageal leiomyoma. Patient of CLD now presented with hematemesis. Patient of CLD presented with hematemesis. Investigation was done, and this is the picture which we are seeing. What is the diagnosis? What happens in CLD patient? If you know it, the answer is in front of you. Even you don't need to look at the image. Dilatation of veins in esophagus. Dilatations of vessels in the esophagus is called as esophageal varices. Right? Esophageal varices CLD में मिलते हैं, right? CLD patient, chronic liver disease patient में मिलेंगे, and they are going to bleed when they are ruptured, right? What is the treatment if esophageal varices bleeds? It is easy if you see. चलो 5-10 मिनट लूँ, 2 मिनट लेता हूँ. चलो see, paper is easy if you take concepts. Paper is not easy if you are going to mug up everything. क्या करेंगे if artery or vessel vein is going to bleed? What we are going to do? We are going to close it, right? क्या करेंगे इसके अंदर? We will ligate that artery or vein. जाके बंद करूंगे ना उसको, vessels को. So what we will do? We will do endoscopic band ligation of the vessels. Endoscope डालेंगे मुंह से and we will close it, right? Concept बनाओ. Paper is easy. नहीं बनाओगे, if you are going to mug up, you are going to attend 10,000s of sessions on the day-to-day basis. It is not going to help. Concept चाहिए बस. Paper easy है. 150 लाना is easy if you have the concepts. ठीक है? A doctor is all about concepts, theoretically and practically. Practical doctors are more successful than the theoretical doctors. Theoretical doctors thesis लिखने में ही अपनी पूरी जिंदगी बर्बाद कर देंगे. प्रैक्टिकल के नाम पे कुछ नहीं आता फिर. So make the concept. We are doctors. We are the sharpest breed of entire world. हमसे अच्छा कोई नहीं, ये समझ के चलना है. इसी को हम बोलते हैं सर्पेंटाइन. मैंने बनाया था सांप जैसा, राइट? सर्पेंटाइन और वर्म लाइक डिफेक्ट. Serpentine or worm-like defect, okay, is seen in esophageal varices. Your favorite image, and I know that you everyone knows, है ना? Bird की नाक is called as bird beak appearance. On what? On barium swallow is called as seen in. Yes, remember it is seen in achalasia cardia. That doesn't mean we are not going to see it in esophageal cancer. If achalasia cardia is not in the option, you will mark esophageal cancer. कोई बोले इसके लिए specific है? Sorry, it is not specific for esophageal achalasia cardia. Okay, it can be seen in esophageal cancer as well. Classically किसमें मिलेंगी? Achalasia cardia. Who will tell me the clinical features of achalasia cardia? अगर ये याद है, you will mark the answer correct, right? Yes, right. Yes, बहुत अच्छे से आंसर कर रहे हो डॉक्टर साहब. वेट, राइट डॉक्टर साहब, वेट. फर्स्ट वन इज dysphagia, then comes regurgitation. Yes, correct. And second, last one is weight loss. This is the classical feature of achalasia cardia. More to liquid than solid. Okay, more to liquid than solid, right? इतने याद रखो. अगली idea finished. This is called as rat tail appearance. Esophageal cancer अच्छे से पढ़ना है, including staging. Okay, esophageal cancer is very common. So of course, in exam hall also, esophageal cancer is going to be asked again and again. Anybody can ask this one. Okay, esophageal cancer आना जरूरी है. I will also take, so don't worry. Take a look over here. It look red and it look white. So what has happened over here? Squamous cell is replaced by columnar epithelium, right? Epithelium ऊपर के साइड होते हैं. So it is seen in Barrett's esophagus. It is seen in Barrett's esophagus. ठीक है? Should I go fast or you guys are tired? क्या करना है? If you want to stop, I can stop. This is called as wine bottle opener. Wine bottle opener. क्या बोलते हैं इसको? Cork screw appearance, है ना? ऐसे होता है वाइन की बॉटल ओपन करने वाला. Same we have it over here. Okay, cork screw appearance. It is seen in diffuse esophageal spasm. Chalo, I will not go in detail. We will just look at the images fastly. What is this? Yes, Lanitis plastica. इसी को बोलते हैं हम water bottle appearance. Seen in cancer stomach. Okay, इस तरह की दिखती है. ठीक है, इस तरह की दिखती है. Okay, water bottle appearance. It is seen in cancer stomach. Patient of CLD presented with distended abdomen. Okay, patient of CLD presented with distended abdomens. Per abdomen was done. Okay, and on per abdomen, doctors have felt on hands something called as fluid thrills. Fluid thrills. Fluid thrills. What is present in abdomen? CLD patient था, liver खराब है, right? So there is going to be something called as ascites. Ascites. Patient is having a pani inside the abdomen. So what we are going to do? We are going to do ascitic tap. क्या करेंगे हम इसे? ascitic tap करके ये पानी हम निकालेंगे. Okay, which parameter decreases? पैरामीटर कौन सा डिक्रीज होगा when we are doing ascitic tap? क्या हो सकता है पेशेंट को सबसे जरूरी? पेशेंट कैन गो इनटू हाइपोटेंशन. किस में जा सकता है? बीपी कम हो सकता है. रीजन बीइंग दिस ascitic fluid is compressing heart. कंप्रेस कर रहा था, एंड इफ यू डू रैपिड ascitic tap, हार्ट को क्या होगा? पेट फिर से नॉर्मल होने की कोशिश करेगा. सो कंप्रेशन ऑफ हार्ट इज गोइंग टू डिक्रीज, राइट? पेशेंट कैन गो इनटू कार्डियोजेनिक शॉक. ओके, ठीक है, क्योंकि नॉर्मल आ रहा है पोजीशन पे हार्ट वापस से. सो पेशेंट कैन हैव डिक्रीज इन बीपी. सो वी हैव टू मॉनिटर बीपी व्हाइल डूइंग ascitic टैप. ठीक है, याद रखना है बात कि बीपी डिक्रीज होने के चांसेस सबसे ज्यादा है. ओके, पेशेंट को कौन से इंजेक्शन की सबसे ज्यादा जरूरत पड़ेगी? दैट इज एल्बुमिन। सीएलडी पेशेंट में एल्बुमिन डिक्रीज होता है, सो वी माइट नीड टू गिव, और एक्चुअली वी आर गिविंग every time albumin before doing ascitic tap. So what we are going to check? Albumin level. And one more level, albumin के साथ और चेक क्या करेंगे हम? PTINR, okay, coagulation profile. Reason being, we are going to prick the abdomen. गलती से some of the visceral organ is damaged. That time patient can have the complication of bleeding. So हमें clotting factors पता होनी चाहिए, इसके पास है नहीं है, right? Again, vitamin K is synthesized in liver, so vitamin K level is decreased, right? So PTNR is going to be deranged. That's why we need to look at the PTNR. ठीक है, याद रखना है बातें. Biochemistry, medicine, everything comes when it is all about practical knowledge. Air under the diaphragm is called as, कहाँ मिलेगा हमें? Abdominal perforation, right? Air under the diaphragm is called as abdominal perforation. इसी को हम बोलते हैं फुटबॉल साइन, राइट? फुटबॉल साइन. इसे हम बोलते हैं फैल्सीपैरम लिगामेंट साइन. एंड एयर जस्ट बीनीथ द हार्ट, air just beneath the heart is called as which sign? Anyone? It is called as cupola sign. Okay, has been asked. Question कैसे घूमेगा? I will just tell in 1 minute. Patient presented with fever, vomiting, okay, fever, vomiting, and ultrasound of the patient has been done. There is radiologist was unable to appreciate appendix. What is the treatment? Fever, vomiting, pain in abdomen. Not able to detect appendix. Answer is appendicitis. So what we will do? Appendectomy. क्या करेंगे हम? Appendectomy, right? अब same question. Patient presented with fever, vomiting, pain abdomen, unable to detect appendix on ultrasound, but X-ray has been done. क्या किया हमने? X-ray has been done. ये दे दिया X-ray तुम्हें. X-ray has been done and there is decrease in BP as well. What is the treatment? आंसर बदल गया, सिनेरियो पूरा चेंज हो गया. नाउ वी आर हैविंग पेशेंट ऑफ एब्डोमिनल परफोरेशन. एब्डोमिनल परफोरेशन हो गया, परफोरेशन ऑफ अपेंडिक्स हो गया विद डिक्रीज इन बीपी. नाउ वी आर नॉट गोइंग टू डू अपेंडेक्टोमी. वी विल टेक पेशेंट डायरेक्टली टू द ओटी एंड वी विल put a big incision on the abdomen and we will do exploratory laparotomy. Answer change हुआ है. This is how the surgery question is going to be twisted. अगर abdominal perforation लिखा है या फिर any sign or any hint of abdominal perforation is there, irrespective of disease, the answer is going to stay exploratory laparotomy. ठीक है, मैनेजमेंट क्या है? एक्सप्लोरेटरी लैप्रोटोमी. Then this image has been asked. Actually ये पहले दूसरे पेज पे पढ़ाते हैं आपको रेडियो में. See, if there is a city of abdomen, what I am saying, city of the abdomen, what you will see? White bones. What you will see? White bones. It is called as city enterocyclitis. city enterocyclitis. And if the MRI of the abdomen is there, bone will be black and more shadow in the organ is called as MRI. Okay, both has been asked. Direct question है था, what is this? This is called as saw tooth appearance. Okay. ऐसे लगेगा दांत बाहर आए. Okay, saw tooth appearance. Saw tooth appearance is seen in diverticulosis. What is diverticular? Outpouching. Outpouching को बोलते हैं हम diverticulosis, right? Diverticulosis. ऐसे outpouchings pouch बनेंगे intestine के अंदर. Okay, investigation of choice for diverticulosis and investigation of choice for diverticulitis. Losses and itis. Culosis means infection, outpouching. The investigation of choice is going to stay CT scan. But what has happened? Itis. Itis. What I'm saying? Itis means inflammation of that diverticula. Okay, inflammation of that diverticula. So उसका मतलब है investigation of choice is now changed. Answer is ultrasound. Answer is ultrasound. See, any kind of abnormalities, best investigation is going to be CT scan. Inflammation, okay, inflammation, most of the time answer is ultrasound. Remember it like this. Okay, you know this apple core deformity on what? Not on barium solo. It is barium meal or barium meal follow through. Answer is cancer colon. Okay, apple core deformity, cancer colon. It look like a coffee bean. It is seen in, चलो थोड़ा फास्ट जाते हैं अभी. Sigmoid volvulus, coffee bean appearance. Bird of prey or bird big sign on barium enema. Take a look. लग रहा है ना बैक से निकला है. It is called as bird of prey or bird big sign on barium enema is seen in सेम sigmoid volvulus. ठीक है, sigmoid volvulus. भवंडर ना, पानी का भवंडर, दैट इज कॉल्ड एज whirlpool. बचपन में ऐड आती थी फ्रिज की, whirlpool sign. Whirlpool sign also seen in what? Midgut volvulus. It is seen in midgut volvulus. ठीक है. Take a look. Only one bubble is called as single bubble. It is seen in congenital hypertrophic pyloric stenosis. Then comes two bubbles. Two bubbles, इसी को हम बोलेंगे double bubble. Examiner's favorite. D goes with D, that is, yes, correct, duodenal atresia. ये तो सबको पता है. और कहाँ मिलेगा? Yes, annular pancreas, or also called as lad band. ओके, हम बच्चों के कंजेनाइटल डिसीज की बात कर रहे हैं. ओके, बच्चों के कंजेनाइटल डिसीज की बात कर रहे हैं. ठीक है, कंफ्यूजन नहीं होना चाहिए. इवन सच इमेज आई कैन गिव यू विथ some other diseases as well, but what we are talking right now about children's congenital diseases. Triple bubble sign is seen in jejunal atresia. Okay, now over here you are seeing more than 3 bubble, that is called as multiple bubble sign. Seen in ileal atresia. It is seen in ileal atresia. ठीक है, चलो करेक्ट. क्या है ये? This is called as target sign. Okay, target sign. It look like a mushroom, so it is called as mushroom sign. Mushroom sign. Okay, if we will make a man, if we will make a man, okay, ये दिख रहा है? This is called as shoulder sign. क्या बोलेंगे इसे हम इसे? Shoulder sign. ये वाला. Okay, shoulder sign. And take a look again over here. Okay, it look like there are two tracks. एक दो, right? Two tracks. It is called as double track sign. Okay, these all things are seen in which disease? Anyone? Congenital hypertrophic pyloric stenosis. Congenital hypertrophic pyloric stenosis. Examiner's favorite topic. There is one white line. बाकी तो समझ में नहीं आ रहा है. I know that. Okay, ऐसा लग रहा है intestine में कुछ डाला है and whole of the intestine we are able to see, but somewhere we are seeing the whitish lines, that is called as string of cantor. One liner सबको आता है, I know that. String of cantor. Okay, all went into gardens and you would have seen such stones. Over here also we are able to appreciate cement with the stones is called as cobblestones appearance, and it is seen in Crohn's disease. कहाँ मिलेगा? It is seen in Crohn's disease. Okay, string of cantor and cobblestone appearance is seen in Crohn's disease. This is called as lead pipe appearance. कहाँ मिलता है? Answer fast. It is seen in, yes, ulcerative colitis. Okay, Crohn's disease and ulcerative colitis also examiner's favorite topic. Okay. Try to answer this. आंसर ये खत्म हो गया एक्चुअली. Yes, it is TB. वेट लॉस है, फीवर है ना, हेमोप्टाइसिस भी है. 90% of the time in India, the answer is TB. So what we are going to see again, a bird. The name of the bird is goose, right? Goose. But goose neck deformity, right? And it is seen in इलियोसिकल टीबी. कहाँ मिलेगा? इलियोसिकल टीबी में मिलेगा. ओके, हार्ट पे भी मिल रहा था. दैट वाज एंडोकार्डियल कुशन डिफेक्ट, राइट? टारगेट साइन, क्लॉ हैंड. ओके, क्लॉ हैंड. आई यूज्ड टू कॉल इट एज सिंगम साइन. सिंगम है ना, मूवी में करता है ना वो हाथ ऐसे. क्लॉ हैंड, शेर का पंजा. एंड इसको क्या बोलते हैं? इट इज कॉल्ड स्प्रिंग साइन. कहाँ मिलेंगे? इट इज सीन इन इंटरसेप्शन. इट इज सीन इन इंटरसेप्शन, राइट? करेक्ट, स्पेलिंग करेक्ट कर लेना बाद में, राइट? वन पार्ट ऑफ इंटेस्टाइन वेंट इनटू अदर पार्ट ऑफ इंटेस्टाइन. क्या हुआ? पाइप के अंदर ही पाइप चला गया. दैट इज कॉल्ड एज इंटरसेप्शन. ओके, इंटरसेप्शन. इट लुक लाइक अ लैडर. इट लुक लाइक अ लैडर, इसी को हम बोलते हैं स्टेप लैडर. किस में मिलता है? इट इज सीन इन बावल ऑब्स्ट्रक्शन. ओके, बावल ऑब्स्ट्रक्शन, एक्यूट इंटेस्टिनल ऑब्स्ट्रक्शन. ओके, एक्यूट इंटेस्टिनल ऑब्स्ट्रक्शन में मिलेगा. Patient was alcoholic. Okay, patient was alcoholic. Now there is discoloration on the abdomen. Okay, discoloration on the abdomen present, and X-ray is done. Okay, it looks like a gasless abdomen. What is the probable diagnosis? Again, repeat karo question. Alcoholic patient, acute alcohol intake. Okay, there is discoloration on the abdomen, and on X-ray done, there is nothing present in abdominal X-ray, or called as gasless abdomen. Answer is acute pancreatitis. What is the drug of choice for acute pancreatitis? What is the drug of choice for acute pancreatitis? Try to answer. It is none. Drug of choice नहीं है acute pancreatitis में. We will just give symptomatic treatment. उसी को हम बोलते हैं कंजर्वेटिव मैनेजमेंट. वी विल गिव आईवी फ्लूइड्स, राइट? पेशेंट नील पर ओरल होगा, right? And to cover a bacterial infection, we will give some kind of lesser antibiotics. Okay, the treatment is conservative. There is no drug of choice for acute pancreatitis. Painkillers देंगे if there is a pain abdomen, right? And take a look over here. It is called as colon cutoff sign. It is called as colon cutoff sign, also seen in acute pancreatitis. But what you will see in chronic pancreatitis? Anyone? You will see calcification. What you will see in chronic pancreatitis? we will see calcification. Okay, we will see calcification. ठीक है, acute में क्या मिलेगा, colon cut off sign और gasless abdomen. Okay, gasless abdomen with discoloration on abdomen, right? Colon sign, gray Turner sign, that means discoloration है वहां पर abdomen पे. See, normally appendix की थिकनेस नहीं बढ़ती. व्हाट वी आर गुड आई एम टेलिंग, अपेंडिक्स की थिकनेस नहीं बड़ी होती, बट इफ देर इज इंक्रीज इन एपी डायमीटर, आंसर इज एक्यूट अपेंडिसाइटिस. इन्फ्लेमेशन का फीचर है, क्या फीचर होता है, एडेमा, है ना, स्वेलिंग, एडेमा होता है. सो इन अपेंडिसाइटिस आल्सो व्हाट वी विल सी, increase in the size of appendix, right? So increase in AP diameter will be seen in acute appendicitis on ultrasound. Okay, कभी कभी you will be not able to appreciate appendix properly. मतलब इतनी स्वेलिंग हो जाएंगे कि तुम्हें अपेंडिक्स ठीक से नहीं दिखेगा. इट लुक लाइक इंटेस्टाइन, के बड़ा इंटेस्टाइन जैसा दिखेगा. So that time also we will consider it as appendicitis and we will do appendectomy. If you have seen old movies, you would have seen such kind of instrument. उसका नाम तुम्हें अभी पता नहीं होगा. The name of this instrument is accordion. Okay, accordion. Okay, it is called as accordion sign. इसको हम बोलते हैं accordion sign. Seen कहाँ मिलता है? It is seen in pseudo membrane colitis. It is seen in pseudo membrane colitis. Okay. क्या है ये? Patient with fever, jaundice, increase ALT, AST, that is SGOT and SGPT, and ultrasound of liver is showing this one. इसको बोलते हैं स्टारी स्काई अपीयरेंस ऑफ लिवर, है ना, स्टार्स दिख रहे, राइट? इट इज कॉल्ड एज स्टारी स्काई अपीयरेंस ऑफ लिवर. कहाँ मिलता है? अरे सिंपल है यार, जॉन्डिस है, एएलटी एसटी है, फीवर है. आंसर इज अक्यूट हेपेटाइटिस. क्या बोलेंगे हमसे? We will see starry sky appearance of liver in acute hepatitis. सिंपल है ये वाला, ये तो बता दो. On CT scan, what you will see? Linings. Okay, there is one abscess with whitish lines. There is an abscess, kind of abscess with whitish line in the middle, is called as hydatid cyst. Hydatid cyst of liver. Liver इस साइड में होता है, right? Hydatid cyst of liver. If we will do ultrasound of that hydatid cyst, okay, hydatid cyst, what we will see? Honey comb appearance, मधुमक्खी का छत्ता. Okay, right? हनी जो बीज होती है वो किस पे बैठती है, उनके छत्ते पे, दैट इज कॉल्ड एज कोम, हनी कोम अपीयरेंस। ओके, यस करेक्ट। नाउ अब कंफ्यूजन किस में होगा, कैंसर एंड हाइड्रेटेड सिस्ट, कंफ्यूजन इसमें होना है। सी, इफ वेल डिफाइंड बॉर्डर्स, बॉर्डर तुम्हें क्लियरली दिख रहा है, whitish line which are there, you are able to appreciate it clearly, you are able to appreciate it clearly, that means it is hydrated cyst. Take a look over here, take a look over here, not able to appreciate clearly, है ना, not able to appreciate clearly, it is always going to be hepatocellular carcinoma, कैंसर है ये। ओके, एब्सेस है किसी और तरह का, तो यू विल सी a blackish clearly shadow, hydrated cyst white line will be clear. Okay, hepatocellular carcinoma में white black mix होगा, no defined borders, right, ये होता है। associated with किसके साथ होता है, which viruses, hepatocellular carcinoma is associated with what, anyone, ये तो पता है, hepatitis B, hepatitis B and HIV, HIV में भी मिलेंगे। Patient presented with AST, ALT deranged, jaundice. Okay, ultrasound is done. Okay, there is pain in right upper quadrant. There is pain in right upper quadrant with AST, ALT deranged. Okay, winter है अभी इस time पे. All of the Nalavasi who is living in the Delhi, they are eating fatty foods, right? They are eating fatty foods, right? AST, ALT deranged हो गया. Pain in right upper quadrant, and this is the image. फैटी खाना खाते हो, राइट, स्मोकिंग ड्रिंकिंग भी करते हैं लोग, सो पेशेंट, so many patients are going to present with gall bladder stone. Okay, gall bladder stone. अब इसी क्वेश्चन को I will twist it around. Okay, I will twist it around. AST ALT deranged, ठीक है, AST ALT deranged, pain in right upper quadrant, fever is there, and TLC or WBC count is increased. What is the diagnosis? Cholelithiasis था, now patient is presented with acute cholecystitis. गाल ब्लैडर स्टोन पहले प्रेजेंट होते हैं, उस पे इन्फेक्शन चढ़ता है, उसी को हम बोलते हैं acute cholecystitis. TLC इंक्रीज हो गया इसके साथ, दैट मीन्स प्रेजेंट पेशेंट इज विथ इन्फेक्शन, इसके ऊपर इन्फेक्शन चढ़ गया। गॉल ब्लैडर स्टोन सिर्फ है तो पेशेंट कैन बी प्रेजेंटिंग विथ एक्ट्रस फीचर्स, उसी का मतलब होता है जॉन्डिस। ठीक है, डिफरेंशिएट करना सीखो, सर्जरी बहुत इजी है। वन क्वेश्चन मल्टीपल आंसर, कैसे बदला, बस आई हैव एडेड टीएलसी वर्ड, टोटल ल्यूकोसाइट काउंट इज इंक्रीज, दैट्स इट, और फीवर लिख दिया। लीवर है, दिस इज लीवर, राइट, लीवर के साथ क्या होता है, वी हैव गॉल ब्लैडर, नाउ देयर इज whitish line and defining gallbladder border very correctly, that is called as calcified gallbladder, calcified gallbladder। ठीक है, थोड़ा सा बच्चा है, 20-30 इमेज। टेक अ लुक ओवर हियर, Take a look over here. It is called as adder head और cobra head. हम इसे क्या बोलते हैं? Adder head or cobra head. It is seen in what? Ureterocele. It is seen in ureterocele. ठीक है? चल. What is this? Are you able to cope up with my speed? अब तक आ जाना चाहिए. ओके, अब तक आ जाना चाहिए ये स्पीड कोप अप करना. इसी को बोलते हैं ड्रूपिंग लिली साइन. ड्रूपिंग लिली साइन. इट इज सीन इन renal cell carcinoma. Yes, renal cell carcinoma. और कहाँ मिलेगा? Yes, Gravids tumor. राइट. और कहाँ मिलता है ड्रूपिंग लिली साइन? ड्यूप्लेक्स. ड्यूप्लेक्स का मतलब क्या था? डबल यूरेटर. ओके, ग्रेविड्स ट्यूमर इसमें मिलता है. ठीक है, ड्रूपिंग लिली साइन. टेक अ लुक ओवर हियर. इट इज वन यूरेटर बट नाउ वी हैव टू यूरेटर. सो इसे क्या बोलेंगे हम? वन यूरेटर इज एक्स्ट्रा ectopic ureter. It is called as ectopic ureter. Examiner's favorite. It is called as, what we will call it? Horseshoe kidney. Correct. Horseshoe kidney. This is called as flower vase appearance. Okay. गमला है ना, जिसमें हम फूल लगाते हैं उसको क्या बोलते हैं? वेज. वेज का मतलब होता है गमला. फ्लावर वेज अपीयरेंस. What happens in horseshoe kidney? The lower poles of kidney will be attached. So this is CT scan. CT scan आ चुकी, X-ray आ चुका है, बचा है ultrasound. Okay, that is also going to come. I will teach that in kidney. अभी बस चलो खत्म करते जल्दी जल्दी. What is this? ये तो पता है सबको. Yes, autosomal dominant polycystic kidney disease. Okay, right? These people are going to survive. Tell me the gene number. Anyone? Gene number is 16. Calculate the alphabet of polycystic kidney. It is going to be, पढ़ लेना. It is 16, right? And gene number 4, PCKD, right? Calculate the number of PCKD, alphabets of PCKD, gene number 4. Then comes autosomal recessive PCKD. These people are going to die in childhood age, right? So बच्चे थे तभी ये बच्चे मर जाएंगे, right? So gene number is बच्चा. So जीन कितने हैं? 1 2 3 4 5 6. जीन नंबर 6. ओके, आता है, आना चाहिए. This image has been asked in recent York exam. Calcified. It look like a calcified whitish kidney, right? Calcified whitish kidney. इसी को हम बोलते हैं पुट्टी, है ना? The which we put on the walls, पुट्टी, right? और cemented kidney. Right? Cemented kidney. And The X-ray of urinary bladder looks like what? It's look like a dot. Okay, it look like a dot. It's called as thimbled bladder. Thimbled bladder. It is seen in दोनों किस में मिलते हैं? It is seen in TB. Okay, TB में मिलता है ये सब. Okay, यूरेटर को क्या बोलते हैं हम? गोल्फ होल यूरेटर. क्या बोलेंगे हम इसे? इट विल लुक लाइक दिस यूरेटर. इसके अंदर होल होगा, है ना? गोल्फ में होल होता है. सो इफ विल प्ले द बॉल, इट गोज इन द गड्ढा. सेम यू विल सी इट. ओके, अभी यहाँ पे तुम्हें नहीं दिख पाएगा और उसकी इमेज आनी भी नहीं है. आना है सीमेंटेड किडनी, पुट्टी किडनी और थिम्बल बैडर, और ये आ चुका है. इसको बोलते हैं क्रिसमस ट्री अपीयरेंस ऑफ यूरिनरी ब्लैडर, एंड इट इज सीन इन, किस में मिलता है? न्यूरोजेनिक ब्लैडर. इट इज सीन इन न्यूरोजेनिक ब्लैडर. ओके, इसे बोलते पियर शेप्ड ब्लैडर, एंड इट इज सीन इन पेल्विक हेमेटोमा. जब फ्रैक्चर होगा पेल्विस का एंड यूरिनरी ब्लैडर इज इन्वॉल्व, it will become pear shaped. Okay, pear shaped that time, right? Winter is there, so the urge to have sex, right, is more. So if people who are not getting it properly, they are going to use such things. Okay, by the front side or by the back side, right? मेरे तो back से. So it is foreign body. Okay, foreign body insertion in the vagina or in the anal region, right? I have seen a patient who has inserted wire inside the penis. Okay, so these are foreign body. What we will do? We have to remove it, right? If someone low wire hai, right? If it is thinner wire, we can remove it. Otherwise, we have to put patient in general anesthesia, and then we have to take this out. Okay. Neuro लेना है अभी, या you want me to take the neuro with the neurology symptom system? Up to you. We will better है कि fresh में लेते हैं. It is very easy, and again there is mnemonics. I will take this with neuro, that will be better. I think so, right? Exhaust हो चुके होंगे, सुबह से पढ़ रहे हो तुम, right? I will take that neuro with the neuro part. Okay, अभी खत्म करते हैं. It is around 1:15. Again I will share the PDF. Neuro वैसे ही छोड़ दूंगा मैं. We will continue this with neurology part. ठीक है, चलो ठीक है. Hope you understood. एक्सरेज अच्छे से देखने. जीआईटी के जब इमेजेस सॉल्व कर रहे हो, प्लीज लुक एट योर सर्जरी नोट्स एज वेल, बिकॉज जीआईटी इज गोइंग टू कम फ्रॉम द सर्जरी. ओके, which session you want to take me in the next class? Please let me know so we can continue with that session. चल ठीक, let me know. Okay, चल, good night to all. Good night.